Being sick while pregnant isn't easy, especially if your favorite over-the-counter medications are off limits. So, what medicines do doctors still consider safe during pregnancy? I'm Sunny Galt with the New Mommy Media Network, and we'll tackle that question and more right after this break. Hi, everyone. I'm Sunny Galt with the New Mommy Media Network, and we are partnering with Pregnancy Magazine to answer the question, what medicine is safe during pregnancy? So our expert today is Dr. Anthony Lissi. He is a family practice physician with Diamond Physicians, and they focus on proactive rather than reactive medicine. So Dr. Lissi, thanks for being with us today.
Sunny, thanks for having me.
All right, so let's talk about how we know whether or not medications are safe or not. How are they rated? How do we know this?
Right, so we've got a rating system in place that allows physicians and allows patients to be able to search for the medicine, find out what the rating is, and know exactly what the harm is to the fetus. We rate them by A, B, C, D, and X classifications. So category A medications. They have advanced animal and human studies that show no harm in any trimester. These are 100% safe medications, and we like to stay in this category as long as possible. Category B pregnancy medications. There are animal studies that show that show no harm to the fetus, but there are no human studies to back that up. So, these are pregnancy medications that we feel are fairly safe, and we use them with caution, but we use them on a day-to-day basis. Now, category C is where we start to weigh out the risks versus the benefits. Animal studies show a risk to the fetus, but in humans, certainly the benefits may outweigh that risk. So certain medications like this just need to be prescribed by a doctor, and symptoms need to be monitored. We need to look at why we're prescribing these medications and if that benefit does outweigh the risk. Category D pregnancies medications show positive evidence in humans as well as fetal harm in investigational studies. And so, again, we rarely prescribe these unless it's really a life-saving therapy for either mom or baby. Category X is animal studies and human studies, definite risk to fetus, and do not use no matter what. These are teratogenic, or they will affect the fetus in a negative way.
Now, how do we, as moms, how are we able to access this information? Is it something we have to go through our doctors, or is there a resource that breaks this down for parents so they can do some research on their own?
Yeah, these lists are abundant online, and it's a fairly standardized classification system. So, we could give you all sorts of websites, but it's as easy as Googling the medication, and pregnancy category is going to be one of the first things that pop up in its safety category. And once you know that classification rating, you'll know what to do about it.
Okay. What about moms that are already taking medications prior to pregnancy? Is it okay to continue to take those, or is that a conversation they have to have with their physician?
Yeah, that's a great question. There are many medications, as we discussed, that are very safe. However, no matter what Google tells you to do or what you find online, it's always appropriate to call the doctor, even speak with the nurse, and say, hey, I just had a positive pregnancy test at home. I'm not scheduled to see you till next week. What do I do about this medication? Whether it's your OB/GYN, whether it's your primary care provider, they'll be able to provide the answer to these questions. And it's important that women, as soon as they find out they're pregnant, it's important that they do that.
All right, so let's break down some medications for moms, stuff that may already be in your medicine cabinet for basic stuff. So let's start with basic aches and pains and headaches. What is safe to take typically during pregnancy?
Right, so anytime we do have aches or pains, and certainly there's a lot of them, unfortunately, during pregnancy, first we start with the basic stuff. So gentle massages, hot packs, cold packs. A lot of times, a heating pad, an ice pack is going to give us just as much relief as any medication. When we do need to use over-the-counter medications, it's really easy during pregnancy. Acetaminophen or Tylenol, that's your best bet. These are the only ones that we want to stick with. I caution not really giving a whole lot of information about what to stay away from, but this one is very, very important because it's in our medicine cabinets every day. Motrin, Aleve, ibuprofen. These are NSAIDs, or non-steroidal anti-inflammatory drugs, and they work in a different mechanism than Tylenol, and they can actually harm the baby. We want to stay far away from those during pregnancy and during trying to conceive as well.
Do we have to be concerned about the dosage for the Tylenol that we take? It's probably pretty standard, but if that's not doing the trick, the standard dosage, can we up that, or is that something that you got to look at on a case-by-case basis?
Yeah, that's a great question. There absolutely is an upper limit of normal dosing for Tylenol. Tylenol is processed in the liver, so if we take too much of it, we can end up with some liver dysfunction. Typically, I tell my patients 500 milligram Tylenol, which is extra strength, 1 to 2 of those tablets, no more than 3 times a day, and we should be good. If you need more than that, it's time to talk to your doctor and talk about what other options are available to you.
Okay, let's move on and talk about common cold and flu medication. What is safe during pregnancy?
Again, let's start with the easy stuff. Let's start with the natural stuff, the non-pharmacologic recommendations. So this is things like saltwater gargles, nasal rinses. We always caution with nasal rinses such as the neti pots. If you're using those, distilled water or boil your water beforehand. Don't use tap water. It can cause big problems. So nasal spray, saline nasal spray, those are the safest to use. Now, what if we need more than that? There are a few medications that we have deemed safe for the common cold symptoms, the runny nose, the congestion, a little bit of that sore throat from drainage. One of those is chlortrimeton. That one is thought to be very safe throughout pregnancy, and so that's typically a first line that we reach for. A lot of people will look at the Zyrtec or the Claritin. There's a lot of mixed reviews out there, and so while some docs may say that that's safe, always ask before you use those medications. Finally, for cough, what if we are up all night coughing? You got to get your rest. Robitussin is a safe cough medicine throughout pregnancy, so reach for that one first. In addition, Vicks Vapor Rub or the nasal inhalation with the Vicks, the menthol, that's been very safe and can really do a lot to help open up our airways and quiet down that cough.
What about cough drops?
I always say caution on the cough drops. There are some very natural ones that work, but always check with your doctor before you use cough drops. Some will have alcohol in them, and obviously we know that's harmful, as are some of the other ingredients in many cough drops out there.
Okay, let's move on. Our last one to talk about is upset stomach, heartburn. I know we talked about heartburn in another video that we did. What are the safe things to use during pregnancy for that?
Yeah, so the safest things are certainly behavioral modification. As we discussed in the last video, let's decrease the size of the meals, increase the frequency of them. Don't eat late at night. Don't eat the fatty foods. Eat more of the natural foods. Now, when we do need something, it's always nice to actually add in fiber. Fiber can help our whole digestive system work well. It can help with the bloating. It can help with our backup of food and constipation and actually acid production as well. Any of the bulk-forming laxatives, such as the Metamucil, those work very, very well in these cases. Carafate can coat the stomach and actually cause a little bit of improvement in symptoms if we do use the over-the-counter Carafate, which is a very safe alternative. And then when we have nausea associated with pregnancy, there are certainly a lot of options out there, many prescriptions, but for over-the-counter, the vitamin B6 pyridoxine is actually very, very safe when taken at 25 milligrams 3 times a day, and it's extremely effective. This helped my wife get through our second pregnancy in the first trimester, which was rather rough for her. So always reach for that vitamin B6.
What about the pink stuff? I feel like people have a lot of the pink stuff or knockoffs of the pink stuff in their cabinets. So what would you say to that?
Yeah, I actually say stay away from the pink stuff. It can cause more harm than it can actually solve. So stay away from the pink stuff. Put that on the shelf for 9 months.
Okay, will do. All right, Dr. Lissy, thanks so much for being with us today. If you enjoyed today's video, be sure to check out our whole library, and you can do that at newmommymedia.com/pregnancy magazine. That's also where you can download our free apps and get access to our newsletters, so you can get information that will take you step by step throughout your pregnancy, because we definitely want to help you out.